Hi everyone, my name is Thomas Payen and I'm here to present my work on monitoring clinical HIFU lesion in prostate cancer using passive elastography, and the work is based on conventional B-mode images. So first, a few words about HIFU in prostate cancer. HIFU treats 74,000 patients every year for prostate diseases, and it's done with three systems mainly that have been approved by the FDA, and including the focal one that is used in this study. The challenge is to monitor the lesion to avoid overtreating, which leads to secondary effects, and undertreating, which leads to relapse. One of the techniques of interest is elastography, because it's the tissue stiffens with the treatment. But the prostate is a deep-seated organ, which makes it difficult to generate a controlled external push, as it's done with the standard shear wave elastography. That's where passive elastography comes into play. Passive elastography is a shear wave elastography technique, but it's based on the physiological wave field. So very briefly, we acquire a diffuse wave field, such as this one, very chaotic, and the whole field of view is under motion. And we use one of the points in this field of view. We correlate the motion with the rest of the field of view, and we get this kind of time reversal experiment where the wave seems to focalize in one spot and then diverge. If we look at what it means in temporally, you can see this focalizing process and then diverging. And the speed at which it focalizes gives you the shear speed here, and then the size of the focal spots gives you the wavelength. If you use a slow rate acquisition, you lose the temporal information, but you still keep the wavelength information, which is really precious for us with our standard systems. So if we look at the process for passive elastography, we acquire raw data, we filter it, and then we estimate the motion using phase tracking. And while doing the correlation, you estimate the elasticity. What happens when you start from the B-mode images that you acquire at a slow rate? How do you get back to the elasticity map? That's the question. As an example, here in the elasticity phantom, we estimated the elasticity with passive elastography. You can see the inclusion pretty clearly. But when you take the envelope of the IQ data, you lose completely the contrast, which you can get back with the technique called glue, which was developed by the team of Professor Rivas, and estimates the motion from the whole frame at once. If we look at the young moduli of these techniques, they are both the phase tracking and the glue pretty close to the manufacturer's value. So we found our missing brick, the glue technique, which helps get back to the motion estimation in our process. We applied it in vitro on 11 bovine liver samples, and we acquired the data before, after, and 15 minutes after treatment. The 15 minutes after was to get rid of the cavitation effects. And as you can see, after treatment, we clearly can distinguish the lesion. And even 15 minutes after, we can still see the lesion. Actually, the heat propagated a little bit. And so there is it's not just a cavitation effect. In patients, we did a preliminary study. First, the question was, can we estimate the wave field in the prostate? As you can see, there is motion pretty much everywhere in the field of view, which is pretty reassuring for us, even though we can't see the wavefronts because it's an acquisition at 22 Hertz only. But this acquisition helped us make these elasticity maps, where you can see that the mass is a little bit stiffer than the rest of the prostate before treatment. After treatment, the region that we treated is much stiffer than the rest. And this was confirmed with the contrast-enhanced ultrasound that you can see on the right, where the zone that was treated is completely devascularized. In conclusion, we performed passive elastography on B-mode images and acquired at a slow rate, and we were able to get elasticity results, even though we were limited to the wavelength maps, and there was a loss in spatial resolution. The glue technique is a good alternative for motion estimation on B-mode images. And finally, the passive elastography is a promising marker for HIFU lesion in prostate cancer. Thank you very much.